Okay, so let's talk about the hip flexors and the interaction with the piriformis, and also how the core is going to be focusing on actually interacting with these three structures to ensure that you are having a stable spine and minimizing the opportunities for a very, very tight hip flexor or an irritated butt. So we have to first off identify the anatomy of each muscle specifically. So with the hip flexor specifically, we'll actually insert on the anterior, the front aspect of your lumbar vertebrae, and they are going to be running down this way, and they actually sit behind your intestines. Now, once they go down into your hip, they actually attach to the lesser trochanter of the femur, which is going to be the inner edge of your femur bone, and it's going to be responsible for truly flexing your hip as well as also internally rotating your hip in some cases, right? So we have that area. We have your anterior core, which is going to be your abdominals, which is going to be from your rib cage down to your pubic bone, and that's actually going to create a lot of the anterior tension. Your hip flexors will also have a responsibility of pulling your back into more of an arch. The reason being is, again, we have attachment point right here at the base of the hip, and we also have the attachment point in the front of your back. So as you have a tight hip flexor, it's gonna pull forward like this. Now, in some cases, we're also dealing with what we call a shear force. And so shear force is not just moving into extension and moving into flexion, but it's going to be the surfaces sliding across each other. And so as the surfaces slide across, that's where we can create a little bit of irritation. Now, how does the piriformis actually act upon all this? The piriformis muscle actually starts from your buttock or your sacroiliac joint around that area, and actually attaches to the greater trochanter of the hip. And so what it does, it's actually going to be externally rotating your hip when you're standing, and then also going to be helping with a little bit of internal rotation. And the thing is that you can tell that your piriformis is very, very tight, where if you can't cross your leg over, and that's where things start to become extremely challenging. And so how do all of these actually work? Now, one thing to keep in note is that when we're walking, the idea is the fact that our hips should be stable. There is going to be a little bit of rotation. But at any point in time, if our hips go side to side, what ends up happening is that this outside hip actually has to engage a little bit more. Primarily, we're looking at irritation of the piriformis. So if you are in fact noticing that your hips go side to side when walking, you can actually remedy that by actually ensuring that your belly button rotates as you walk instead of side to side. But how does this all work? Your abs, your hip flexors, and your glutes. Now, this is one of many cases, but this is going to be the most common scenario where if you do not have enough tension in your core, you are going to have a little bit of excessive motion at your back. And so our bodies need to create the level of stability so it in fact feels safe. So the two common areas when you are not the most stable on your anterior core will actually be creating a lot of tension right here in the hip flexors, either presenting itself with anterior hip pain or anterior hip crease pain, or a little bit more of an arch. And so if you have a little bit more of an arch or a little bit more anterior hip pain, you're also possibly dealing with a little bit of shear force. And that little bit of shear force is what we like to call instability. And again, that body tries to create as much stability as possible. So what's the next thing that actually gets tight? It's going to be the piriformis and the buttock. And what that does, it contracts, right? It kind of locks your hip into external rotation and extension, and it's just trying its hardest to make sure that there's not too much shear force happening at the spine. And so what happens when we contract our abdomen? When we contract our abdomen, we might go from like a super arch position or a lot of shear force. Once we closed in that area to allow us to contract and build a little bit of tension on the front, we can actually create 360 degrees top and bottom tension, which means that our hip flexors do not have to work as hard, which means that hip crease pain might start to dwindle a little bit. That arch or that shear force might start to dwindle a little bit as well because we're creating that stability. But then the second part is being able to, if we can contract our abdomen, the glutes won't have to work as hard, specifically the piriformis, because we're looking at hip stability. And that's where we're going to start to notice an improvement. And so that's why it's important. And you don't have to contract your abs 24/7. We're just ensuring that there's going to be a little bit of tension, which ensures that you do not fall over like a wet noodle and that you're not creating excessive shear force on your back or your hips.